Welcome back. In today's video, we'll be working through practical case-based projects where you'll have the opportunity to create personalized care plans for different scenarios. These case studies are designed to help you apply everything you've learned about depression management, from assessment to treatment, and build your ability to create effective, individualized care plans for patients. Let's dive into the first case. Case 1, a patient with moderate depression and no previous history of treatment. Our first case is Tom, a 32-year-old male who presents to your clinic with low mood, lack of energy, difficulty concentrating, and sleep disturbances. He has no previous history of depression and is seeking help for the first time. His depression seems to have been triggered by ongoing work stress and a recent breakup. Step 1, initial assessment. The first step is to conduct a thorough assessment. We need to rule out any underlying medical conditions, such as thyroid issues or vitamin deficiencies, that could contribute to his symptoms. We'll use a screening tool like the PHQ-9 to evaluate his level of depression and determine its severity. Step 2, creating a treatment plan. For a patient like Tom, whose depression is moderate and triggered by external stresses, we can recommend the following. Medication. Start Tom on an SSRI, selective serotonin reuptake inhibitor, like sertraline or fluoxetine. These medications are effective for moderate depression and have a relatively favorable side effect profile. Psychotherapy. Refer Tom for cognitive behavioral therapy, CBT, which is well suited for individuals with depression related to stress and life events. CBT can help him address negative thinking patterns and develop healthier coping mechanisms. Lifestyle modifications. Encourage Tom to engage in regular exercise, which has been shown to improve mood and reduce depression symptoms. Also, help him establish healthy sleep hygiene and manage stress through relaxation techniques or mindfulness. Step 3, follow-up care. Schedule a follow-up appointment for 4-6 weeks to monitor Tom's progress, evaluate the effectiveness of the medication, and ensure he is adhering to therapy. At this follow-up visit, discuss any side effects of the medication and adjust the treatment plan as needed. Reflection questions. How would you assess the severity of Tom's depression using tools like the PHQ-9? Why is cognitive behavioral therapy, CBT, particularly effective for someone like Tom, whose depression is triggered by stress and life changes? Case 2. A patient with chronic depression and multiple episodes. Now, let's consider Rachel, a 40-year-old woman who has experienced multiple episodes of depression over the past 10 years. She is currently in a major depressive episode and reports feeling hopeless, tired, and disengaged from life. She's tried medication in the past, but often stops taking it due to side effects like sexual dysfunction and weight gain. Step 1, reassess the treatment plan. Given Rachel's history of recurrent depression and her difficulty adhering to medication due to side effects, we need to adjust the treatment plan. Medication adjustment. Since SSRIs have caused side effects in the past, we may switch Rachel to a different class of antidepressants, such as an SNRI, serotonin norepinephrine reuptake inhibitor, like venlafaxine, which can be effective for both depression and anxiety. Alternatively, we might consider bupropion, which has a different side effect profile and might be better tolerated. Psychotherapy, interpersonal therapy, IPT, might be a good choice for Rachel, as it focuses on improving relationships and addressing interpersonal stresses that may contribute to her depressive episodes. Additionally, cognitive behavioral therapy, CBT, can help her recognize and challenge negative thought patterns that perpetuate her depression. Lifestyle changes. Encourage Rachel to engage in physical activity and mindfulness exercises to improve mood and manage stress. Discuss the importance of good sleep hygiene and healthy eating habits. Step 2, addressing medication adherence. Since Rachel has had trouble adhering to medications in the past, it's important to discuss the potential side effects up front and develop a plan to address them. We might consider lowering the dosage to start with, gradually increasing it, and providing continuous monitoring to address any side effects early. Motivational interviewing techniques can also help improve Rachel's engagement with her treatment plan. Step 3. Long-term management. Given Rachel's history of depression, this care plan should include a long-term management approach that includes ongoing therapy, CBT or IPT, for relapse prevention, regular medication reviews to ensure treatment efficacy, monitoring for early warning signs of depression recurrence, and providing support at the first sign of a setback. Reflection questions. How would you adjust the treatment plan for chronic depression with recurrent episodes? Why is medication adherence such a key factor in long-term depression management? And how can you address barriers like side effects? Case 3. Managing treatment-resistant depression. Next, we have Sarah, a 28-year-old woman with severe depression that has not responded to SSRIs or CBT after 6 months. She has been on multiple medications and undergone therapy, but her symptoms remain unchanged. She feels hopeless, isolated, and reports low motivation. Step 1. Reevaluate the diagnosis. Since Sarah's depression has not responded to treatment, we need to reassess the diagnosis. Is there another underlying condition, such as bipolar disorder, schizoaffective disorder, or anxiety? We'll perform a more thorough assessment, possibly including psychiatric testing, or reviewing her medical history more closely to rule out any comorbidities. Step 2. Advanced treatment options. For treatment-resistant depression, we may need to explore advanced treatment options. Switch to a different class of medication. Consider MAOIs, or tricyclic antidepressants, TCAs, or even antipsychotics in conjunction with an antidepressant. Electroconvulsive therapy, ECT. If Sarah's depression is severe and chronic, ECT may provide rapid relief. Transcranial magnetic stimulation, TMS. This non-invasive procedure can help stimulate nerve cells in the brain and may be beneficial for resistant depression. Step 3. Psychosocial support. Ensure Sarah has strong psychosocial support through therapy, peer support groups, and family involvement. This will help her develop coping mechanisms and reduce isolation. Reflection questions. How can you adjust the treatment plan for a patient with treatment-resistant depression? What advanced treatments should be considered for a patient who does not respond to first-line therapies? Embedded knowledge quiz. Let's review what we've learned with an embedded knowledge quiz. Question 1. What is the first step when managing a patient with recurrent depression who is experiencing side effects from SSRIs? A. Switch to a different SSRI. B. Try an SNRI or consider adding bupropion. C. Discontinue medication. D. Switch to a tricyclic antidepressant, TCA. Answer. B. Try an SNRI or consider adding bupropion. Question 2. Which treatment option is typically used for treatment-resistant depression? A. Electroconvulsive therapy, ECT. B. Increased dosage of SSRIs. C. Psychodynamic therapy. D. Switch to a new therapist. Answer. A. Electroconvulsive therapy, ECT. Question 3. What is the first step in managing a patient with depression and comorbid anxiety? A. Prescribe a mood stabilizer. B. Increase the dose of antidepressants. C. Prescribe SSRIs or SNRIs. D. Focus solely on treating anxiety. Answer. C. Prescribe SSRIs or SNRIs. Clinical vignette. 1. A 45-year-old patient has not responded to SSRIs or therapy for depression after 6 months. What is the next appropriate step? A. Increase the dose of the SSRI. B. Reassess the diagnosis and explore alternative therapies. C. Discontinue all medications. D. Refer to a psychiatrist immediately. Answer. B. reassess the diagnosis and explore alternative therapies.